Well, respiratory therapist is an amazing career for new people to want to enjoy healthcare. We can go down to the beginning of the life with babies and neonatals and go up to the end of the life with elderly people. So we treat people with neonatal conditions like newborns with 23 weeks, 24 weeks, 26 weeks, and go up to the end of the life one more time. So it's amazing to go at this point right now to NICU to take care of babies. In the next 30 minutes, I can be in the ER taking care of trauma, car accident, or something like that. And the next time, I can be in the ICU taking care of a cold blue with everything can happen, you know, but we always at the bedside of the patient trying to take care of this person's needs and save the life. So that's my main goal all the time. So my name is Mauricio. I have been working in UNC healthcare for 4 years now. I'm from Colombia, so I have a really strong accent. So, but I love to work here, and this is one of my dreams that I have for a long time, to be working in healthcare, and this is my best choice right now. So.
I'm Jason Sadowski. I've been at UNC Health for almost 10 years. I really love my job. I love the adrenaline rush you get when you get called to codes and rapid responses. Respiratory, we're looked at to assessing patients and giving doctors a better view on what's happening to the patient before they actually have hands-on. Right now we're in our department, respiratory department. This is where we sit down and do a lot of our documentation.
See some equipment that we work on it, and then we can go to the ICU, progressive, and NICU, babies, and all that stuff.
Right now we're in the emergency room at UNC Blue Ridge. Whenever we get called down here, it's not just only respiratory patients. It could be constant sedation patients that need us to manage airway while setting broken legs, arms, dislocated hips and shoulders. So we just not just do respiratory, we actually do whole patient care. On the basic level, we do patient assessment and breathing treatments. That's just at the basic bottom level. Then we manage people on BiPAPs and ventilators, which is more on the expert level, more getting hands-on to with the patient. And also, we coordinate with ICU teams to make sure there's a whole patient care team dealing with that patient. This is where we stock our ventilators and BiPAPs for the ED.
So this is a ventilator. When somebody's a critical life condition, we use the ventilator to provide oxygenation, control the breathing, and be able to supply all the needs regarding oxygenation. That's the tube that we put into the endotracheal tubes. So once we intubate, we're gonna attach that machine to the patient.
There's a lot of times where we might be on the floors documenting and stuff like that. We get called to the emergency room, and we actually be down here within pretty much 2 or 3 minutes to intubate, or somebody could be coding. It all depends. EMS could be en route, so we have to get down here in a hurry to assess the patient and get what we have to get done. Yes, we are pretty much on call throughout the whole entire day. We don't just have a set of 5 patients, we have the whole entire hospital. I kind of see it as we're actually the EMS of the hospital. When something gets done, we get called, we have to rush to whatever area we need it in.
That's what I like for my job, that I never get bored. You know, I always even in the action, help patients in the ER, go to the ICU, go to see the baby. So it's never boring. You don't have like set up of patients that you see all day long. You just go back and forth in the whole hospital. So it's really exciting.
We have to go to every single code blue. When code blue, we manage airway as far as bag mask valve, ventilating patients, intubating the patients. Also, we are responsible for chest compressions. Also, whatever they need, we're there for them.
I come in the morning. I never know what's gonna happen, how's my day's gonna be. So this is the NICU. We have a small NICU in the hospital, but it's always.
So this is your supply room?
Yeah.
The supply room for the babies.
Wow. There's specialized equipment we use for neonates and babies. Here's basically a CPAP or a BiPAP for a child. A lot of times when a baby's born premature and they're not ventilating properly, we have to put them on this. Basically, it's a CPAP made for babies. It gives a certain amount of pressure and oxygen, and you have to make sure you monitor your children properly, because too much oxygen can lead to complications with the eyes and stuff like that. It can actually cause a child to go blind.
Wow. So all of these are respiratory devices here?
All this, we have our of course our CPAP, we have heated high flows for babies, we have a Drager vent for a baby. So everything's specialized just for the NICU.
And this is a ventilator, this is a Drager. We use this one with the babies.
Wow.
They intubate him, and then we try to manipulate the ventilator to provide the needs for the baby.
You guys have to have a lot of like math and physics training in a way, don't you? Because you have to know what the volumes the lung can handle, right?
Yes,
The
yes.
tiny little lung is...
Yes, everything is based on ideal body weight of the patient and based on, like in babies, how much kilograms they are whenever they're born to determine the proper tidal volumes to put inside patients. Because you can blow lungs, you can cause pneumothoraxes if you too much volume. You can really hurt a patient.
Wow.
Let's see if he asks me that.
Yeah.
I'm in there.
We have a full house in here. Good.
So this is
Oh,
where
they're
it takes
cute.
place, right? Yeah.
Yeah.
And you work in these little bed units here. What is called? These warmers? What are these?
Isolate.
Isolates. All right.
You're welcome.
Now let's go to the ICU.
All right. So what percentage of your time do you spend up here? Is I imagine a lot, right?
It depends on the acuity of the patient and how busy we are. There are some days, like during the fall and winter time, where we don't leave out of the ICU because you're just constantly in need all the time.
Has it been like a lot of COVID patients over the last couple of years, right? But it's starting to slow down some.
It's going down now, yeah, but in the beginning, we spent the time in here all the time, 12 hours in the ICU. We don't have time to go anywhere because it was so busy.
So you guys are like critical to the
Yes.
care of COVID, right?
Yes.
I love it. Every day is different. You see the same patient, but every day is different scenario. It's never the same. So it's really cool and amazing. We're like, Batman and Robin. That's why I tell people we're like more like Batman and Robin. We do all the fun stuff, then we leave. And I see we monitor like or BiPAP or vents and stuff like that. So we assist with the pulmonologist, the nursing, handling all that, because that's our expertise. So if a patient is not doing so well on it, if they need more FiO2, we could increase, decrease. If they need more, support on like BiPAP, we could monitor that, and on the vent too. So that's what we do.
Have you ever had any regrets about becoming a respiratory therapist?
Moments I did. Sometimes like, oh, why did I do this for? But then you have moments like, you see something happen, like a miracle happen. You didn't think this patient going to survive, and they do a 360. And you're like, that's what rewarding. Very rewarding to see somebody leave the hospital and doing a lot better. You get to use your brain a lot. Kind of say, okay, yesterday they were fine, today they're not. What's going on? And we troubleshoot that. So it's really amazing. So respiratory is a great field.
Oh, really?
You gonna run over me? Okay.
It wasn't a great reading, it wasn't.
So tell us about the area we're in now. This is like a step down unit or something?
Yeah, right now we're in a progressive step down. We still have ventilators in here, but sometimes they're not as critical as the ones in the ICU. Excuse me.
So right now we have a ventilator running right here. We control all the settings of the ventilator, so we have the knowledge to know exactly how much volume we need to deliver to the patient, how much oxygen we need to deliver to the patient, and what is the requirement that this patient needs to ventilate and oxygenate. Now just remember that our respiratory therapies, we have to complete with the function of the lungs, with that oxygenate and ventilate at the same time. So we have to be sure that we provide the oxygenation, and we also provide the ventilation that the patients need. We control the rate of respiration, we control the tidal volume, and we control the oxygenation as well. So we have to know all the settings on the vent, be able to control the alarms, and be sure that we know what we're doing. We had the opportunity to communicate with the students as well. When they come to see the clinicals, every time they come to here, it's like an opportunity to an interview.
Yeah.
So we know which people we like to hire already. Now we have a new program with the high school students.
Yeah.
So when they finish the high school, they're able to come to the hospital and follow us and see what we're doing. So they can make a decision for his life to start a new career in healthcare and which one to pick, Most of the time they love RT, so we actually have few students already enrolled in the program.
This profession does pay very well, doesn't it? I mean, it's pretty good, right?
After COVID, RT finally get recognized bigger than before we was. So now it's really good for the incentive. I mean, we are making a decent kind of money right now.
Oh yeah.
The needs for the artists getting higher, so it's a high demand right now for artists. So I'm very sure if somebody going to the career, they're gonna find multiple options to work in different places.
Victoria, what do you think about the respiratory guys and ladies?
I think that they are very smart. Before I started working here, I actually thought that they had their RN degree and then like specialized in respiratory because they know so much, and every time I call them, have any questions, they are more than willing to come up here and assess anything, even if they're super busy. Sometimes they have the task of going around the entire hospital and being the only one here for multiple floors, and they still come up and answer our questions. So I appreciate it very, very much.
This place,
Then why is she on a trilogy, which is way more than that?
Yeah, and this one is not expensive, and they provide. Well, I don't know if they are used or what, you know.
Yeah, if you can get the doctors to sign off and trying her on an LTV, which I don't see why we could not put on
I'll go
LTV
talk to Phillips right after you show me.
to see how well she lasts on it. We have a patient that is on a home ventilator or a home glorified BiPAP machine, and so far now it's not doing the proper job for her. So we're going to try to get on a different machine so she's able to go home to spend more time with her family, her, her kids and stuff like that. Over here to the right, sir. Go ahead this way.
They're the bins we used in our emergency department when I was working in New York.
It's a very good possibility.
Yeah. Yep. I know this animal.
Yeah.
Okay.
So we actually use this as one of our transport ventilators. We take them to CT and stuff like that. It does everything that a regular ventilator does. I think a 4-day trial should be sufficient.
Okay. Brother, thank you so much.
Ain't no
You
problem.
have no idea how much closer we are to figuring this out. Thank you.
Good, I'm glad to help.
Oh man, I'm glad you were here.
As you can see, we work with not just nurses and doctors. We work with case management, trying to make it better for patients to get home.
This is the leadership of the department. We have the supervisor, Tammy Becana, and the director, Felicia Ferguson. So.
Good morning, good morning.
Respiratory is an exciting field. It's not just like nursing where you're just up there on the floor with the same 6 patients. You're all over the hospital, and it's exciting to be able to help people breathe, take care of their needs. It's a fun field.
The respiratory team that we have here is phenomenal. They're focused on patient safety, but they're also focused on teamwork, which we strive on. We all rest together, we all work hard together, and we all try to eat together. But what the best thing about respiratory therapy is that you, at 1 minute, can be intubating a patient and putting them on life support, and at the next minute, you can be up on Family Center helping and assist with the delivery of a newborn baby. And so you get to see from one end to the other all aspects of life.
The teamwork that we do have here is great. I know if I'm stuck in ICU and I'm behind, I know that Mauricio, one of my cohorts, will come and bail me out to help me. I know I always get 4 or 5 phone calls a day. Hey, Jason, you doing okay? You need any help? So no matter how busy I am, I always know they have my back.
We have any student in here.
What?
Hi, I'm Allie. I'm a student at Catawba Valley Community College.
Well, what's it like being a student in respiratory and coming to a place like this and working?
It's mind-blowing because not a lot of people know what respiratory is or what respiratory do, but they are amazing. They take care of their patients. They do a lot for their patients. So in class, they teach you a lot of stuff off the books, but when you come and do hands-on clinical, that's where you really get to experience and put what you learn in school into reality. It's a good job and I like it. Respiratory is great. If any of you guys want to get into it, we're evolving, especially with COVID-19, and the field work is going to grow much more from here.
When you go to school, you learn bits of information. Then when you come to the hospital, it's like you build the bridge between each information and stuff starting to click and go, oh, I know what they're talking about in school. Yeah. And especially at this hospital, we pride ourselves on being student friendly. We want to take the students wherever we go. We want them to see everything. We want them to be hands on here.
school is crazy, but once you're on your own and see it, you're like, oh, this makes sense, you know. And don't be afraid to ask a question. There's no stupid question, because I have asked before. I'm like, okay, just can you clarify this? Like, I just quite don't understand. And everybody explained things so differently. Like, Jason could explain it a little bit more elaborate, and Mauricio could just dumb it down for me. I'd be like, oh, it clicked, you know? Just the way how you understand things.
You guys seem to be a tighter group to me.
There's fewer of us in the hospital, so we have to rely on each other. I can't do my job unless Clea and Marisa are around me. It's impossible. So we are a tight-knit family.
I mean, how many do we employ here at this
I'm not sure the total number we employ, but
It's
usually
around 27 right now.
27?
But we have about 3 to 4 therapists in this hospital per shift.
Per chief.
Yeah.
Yes.
Do you guys prefer working day or night? I know you've worked nights.
I work night, I work day. I mean, night never bothered me.
Yeah.
It was good for family, like, because my kids, they were like very little kid, but they were like elementary. So it helps from going from night for family stuff. But for day, now my kids are older, you know, I feel more like I'm a human because my sleep pattern is normalized, you know.
Yeah.
But nights or day, they're both good. You see two different worlds, so
Yeah.
I love it.
Yes,
So.
with night shift, you have fewer doctors, so you have fewer support system around you. So on night shift, you better be on your game when it comes to patient assessment and giving the proper care to a patient, and be able to know when a patient's going to crash before it actually happens.
Oh yeah, they're amazing, and we can't do our job without them. You know, we get really busy here in the emergency department all the time, and we really depend on them to come down and help us out. They've saved us and our patients countless times, and you know, it's a position that not only myself but everyone in the hospital really respects, and I would strongly encourage anyone who's interested in getting into healthcare to consider going into respiratory therapy.
Michelle, you're an RN here in the ED.
I am.
Tell me what respiratory means to you guys as nurses.
They are a huge help in taking care of, you know, all of our respiratory patients. You know, starting some nebulizers and being there to assist the doctor with intubation. Just always a key asset to our team down here for all emergencies.
Jason Sassi again at UNC Blue Ridge. I hope all you students consider respiratory therapy as a future investment and job opportunity.
I came to this country 20 years ago, and this is a life change for me. This is a great opportunity for everybody to enroll in the program for RT and grow up in the healthcare career. Nobody gonna be disappointed with this career. It's rewarded. Talking about money is good. The compassion that you develop with the patient is good. The reward when you see somebody walking out of the hospital is good. So there is different ways that you're gonna feel accomplished with this career.